Veneers are one of the most common cosmetic dental treatments. Here is what the process actually involves. Veneers are thin, tooth-colored shells bonded to the front of the teeth. They change how teeth look, not their position. Dentists use veneers to cover deep staining, chipped or worn teeth, small gaps, or mildly uneven front teeth. Good candidates have healthy teeth and gums, stable bites, and realistic expectations. Cavities and gum disease are treated first. There are two main types. Porcelain veneers are lab-made and highly stain-resistant. Composite veneers are shaped directly onto the tooth. Planning starts with photos, scans, and a smile design. Any decay, gum issues, or whitening are handled before veneers. For porcelain, the dentist reshapes about 0.5 millimeter of enamel from the front of each tooth. Local anesthetic keeps it comfortable. Impressions or scans are sent to a lab. Temporary veneers protect the prepared teeth until the final ones are ready. At the next visit, each veneer is tried on, adjusted, then bonded with dental cement, hardened by a curing light. Recovery is short. Mild sensitivity, gum tenderness, or slight speech changes usually settle within days to a couple of weeks. Risks include chipping, debonding, ongoing sensitivity, or gum irritation. Veneers do not protect the tooth from decay underneath. Porcelain veneers commonly last 10 to 15 years or longer. Composite veneers usually last around 5 to 7 years. Veneers are cared for like natural teeth. Brushing, flossing, avoiding hard biting habits, and regular checkups keep them lasting. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.